When I think about euthanasia being a gift, I think about the gift that it gives to the pet. When we have a hit by car or a pet that comes in that can't eat or walk appropriately and its quality of life is just completely gone, and we have the opportunity to perform humane euthanasia as an option to bring that pet comfort and peace and rest, that is something so powerful. Hello, and welcome to the Evolved Vets podcast. I'm your host, Dr. Bethany Weinheimer. Hello, and welcome to the Evolved Vets podcast. I'm your host, Dr. Bethany Weinheimer, and this week I really wanted to get into the difficult discussion around euthanasia. Now, for me, euthanasia, I truly believe, is a gift. It is something that is so powerful, it's so moving, it's so emotional, and it is this huge responsibility that we have as veterinary professionals, and it's peaceful and it's calming for the pet in real time, and it is also a little bit heartbreaking and saddening, and experiencing the grief of the pet owners in the room is very emotionally tolling. And all of that comes together to be this big picture of euthanasia and my controversial opinion around the idea that euthanasia is a gift. And when I think about euthanasia being a gift, I think about the gift that it gives to the pet. When we have a hit by car or a pet that comes in that can't eat or walk appropriately and its quality of life is just completely gone, and we have the opportunity to perform humane euthanasia as an option to bring that pet comfort and peace and rest, that is something so powerful. And then there is a world where that grief that the customer is experiencing is so deep and you feel it so deeply too. Man, those moments all add up, and it is stressful and sad and emotional. And so if you're anyone who has lost a pet, and you're listening along, I just want to give you my sincerest and deepest love and understanding for the grief that you're going through. You are not alone in this. Your vet feels it with you. You have loved ones around you. Your pet knows that you made that decision with the best of intentions and that they love you no matter what. This week, I had several difficult euthanasias. And when I got home at the end of the week, I was reflecting on what those euthanasias meant to me and this concept of the humane euthanasia is a gift idea. I talked about the idea of humane euthanasia being a gift to pass our pets on from the pain and challenges that they might be overcoming, or health diseases or surgeries that are life-threatening, and transitioning to the other side, whatever that might look like to you. Some people prefer to use an analogy of the rainbow bridge. Some people prefer a specific higher power, depending on the religion that you believe in. Some people just believe they're up there, playing with their favorite ball or enjoying time with other pets that they once loved and other loved ones that they had a part of their lives. Whatever you believe, the process of transferring is usually quite peaceful, and there are many, many ways that you can do this procedure. Now, when I was trying to make a statement about this controversial opinion, there was a moment where I started to cry. I was thinking about the grief of the customer, the challenges that we feel as veterinarians, and our obligation to advocate for the speechless, the animals that we have in front of us. And as I started to have this, what was supposed to be, 30 to 60 second high level thoughts on euthanasia, turned into a several minute video that I broke into 6 different parts. And as I got through the first section, I just started sobbing. And I realized in that moment that even me, someone who is very emotionally intelligent, does a lot of the work, does the meditations, the journaling, is very informed on trauma and trauma therapies. Even I was processing the challenges and grief of euthanasia real time. I was sitting on my couch, I was at home, and I was supposed to be enjoying an evening off, and that turned into, almost like a 20-minute moment of me crying. And I shared that with everyone on Instagram and TikTok at Dr. Beth the Vet, because I thought there was just something so real about what we experience when we go through the process of euthanasia and the challenges that we feel, and how me on a random day at home starts talking about euthanasia and then suddenly starts to cry. Like, clearly the body is keeping the score on those traumas that we experience and what we hold inside after going through those procedures. In the hospital, there are moments where we perform the euthanasia procedure and then we turn around and we jump to the next case. Maybe it's a puppy vaccine exam or a seizing dog, whatever it might be. Our attention span for those moments are very narrow in time because there's always other patients that need our attention. And how often do we go back and actually reflect on the ones that do hit us so deeply? Like, those matter so much. And so just the journey of this week and hearing all these amazing comments from people and understanding what the grief is like from the pet parent side, as well as the kindness and love that comes from the veterinarians and all these different stories, like, it has just been so transformational and impactful. And so I really wanted to deep dive the concept of euthanasia, how some ideas that I'd love to brainstorm with on how we can make it better. And I'd love for y'all to leave comments, follow along on TikTok and Instagram. I want to hear what y'all are doing to make your euthanasia procedures better. And then also, I love hearing the beautiful stories about people's animals. And even though they've passed on, maybe the grief that they're feeling or challenges with the decision that they made. And it's all a very real life experience. And I'm really grateful that people are opening up and being vulnerable. It's very true to who I am, and it's something that I deeply care about and empathize with for our pet parents, our fellow veterinarians and veterinary staff that deal with this every day. It is a very complicated topic, and so I want to dive into that with each of you this afternoon. The weight we carry, euthanasia, grief, and what no one was able to teach us in vet school. Now, many people believe different things when it comes to the topic of humane euthanasia. People have different religious beliefs, different personal beliefs, and I respect all religions when it comes to this discussion topic. I'm truly just speaking from the perspective of an emergency veterinarian and what I see in the exam room and on the treatment floor when it comes to these end-of-life moments, especially in pets that are in true emergencies, right? I also have a very narrow view of what that perspective is. So if you're interested in joining the conversation, follow along at Dr. Beth the Vet, and I'd love to hear your ideas, comments, and just really your stories around this topic too. Now, when we talk about euthanasia, I don't just want to talk about the clinical procedure. You've done it several hundreds of times, maybe thousands, depending on how long you've been in the field. But I want to talk about what it does to us, what it does for us, the weight that we carry home, and then also how we process through the feelings that come up, how it lives in our body in some ways, and how sometimes we don't actually show or realize the impact of that until much later, sometimes years later. And there's these moments where we're holding the pet's paw, or maybe we're holding someone's hand or placing our hand along their back, and we're there supporting these owners and pet parents when they say goodbye. And we're experiencing that goodbye too, and just in different ways. And then we're expected to move to the next appointment, the next triage, like nothing happened. And that is hard. It's hard to balance and jump from one thing to another. And so let's dive into how we weren't really taught or prepared how to solve through this or how to work through it in our minds and our bodies. But let's think about solutions and how we can actually make our euthanasias better and help one another. Now, veterinary medicine is a healthcare profession where we are regularly trained and expected to legally perform an authorized end-to-life or humane euthanasia. This is common practice in the United States. Different countries across the world have different opinions on euthanasia and different laws surrounding it. So if you're listening in from, some of our other countries that have listeners like Canada, India, New Zealand, Australia, please chime in. We really want to hear what your experience with euthanasia is like as well. And even from different professions. On social media this week, I had a physician from Canada who had messaged and given details about their experience with euthanasia as well. So there's been a study that found over 75% of veterinarians receiving 0 hours of training around self-care in their veterinary education. So this was a study from MentorVet, and that's so interesting because that's 75% of people in our profession saying they received no training on this form of self-care and how to take care of themselves through a euthanasia process. We learn, pharmacology, anatomy, we learn about parasitology, we learn how to calculate drug doses, and all of that is very important data and how to perform the procedures and the pathophysiology behind disease processes. But also it's important to learn how to process our feelings, our emotions, and the weight of what it is like to have an animal pass and the grief of the people that are in your room while that happens. So we learn how to do it alone, right? Maybe you cry at home on your way from the car. Maybe it's at 2 a.m. after the hospital slows down. Or maybe it's like me when you're filming an Instagram video and then suddenly break down into tears. And all of those are okay. And as a coach, I sit with veterinarians and I hear their stories. And I can tell you euthanasia is something that comes up. And it's not in the way that you would expect it. Rarely is it, I did a euthanasia today and I feel sad. It's usually more like, I was in that euthanasia and I feel numb and I don't know why. Or I used to cry and now I can't make myself cry in a euthanasia anymore, and that really scares me. Or I've heard stories like a client thanked me for being so calm and compassionate in the euthanasia, but I was just so tired. I didn't actually feel those feelings that were coming up. And when we are starting to notice these feelings of compartmentalization and we are struggling with the processing of the emotion, that's why I want to do this deep dive today. I've also had people come to me and talk about convenience euthanasias. That was a comment that we had this week too, surrounding like, what about a behavioral euthanasia? Or what about a financial euthanasia, right? I can't stop thinking about these cases where I had to perform a euthanasia out of context of what I normally would perform a euthanasia for. And it's those moments where we start to learn the gravity of what we're doing and the impact of what it has on us as veterinarians. I've heard a client once say, I built a wall around my heart so I can do this job, and I don't know how to take it down. And it's starting to impact other areas of my life too, like how I show up for my family, how I show up for my kids. And honestly, I've had moments in my life where I've been there, and processing real time what happened after going through these types of difficult cases is so important. And that's why I want to do a deeper dive on what that can look like for us today. So let's talk about what an actual code feels like, because I think that's kind of the highest intensity version of this. And then we'll kind of go through the different types of euthanasias as well. So let's say you're in the emergency room and it's 11 p.m. and a dog comes in, was just hit by a car. The owners are screaming, the pet is bleeding. You walk over quickly, see that it is a very urgent situation. Your techs are coming in as well. They're already placing a catheter, getting a blood pressure, placing an IV. You're calculating a fluid bolus so we can get medications going, and the heart stops. And at that time, your team flips the pet over and you start chest compressions while performing advanced life-saving procedures. And as you're doing compressions, the veterinarian steps over, or what I do in these scenarios is I step over to the customer and I say something along the lines of, your pet no longer has a heartbeat. Would you like us to continue with the process of CPR, cardiopulmonary resuscitation? And most of the time, if it's within their religious beliefs, they say yes, and we continue moving forward with chest compressions, and we give different life-saving drugs like epi in order to help try and revive the heart. Let me speak directly to the woman who feels like she's barely holding it all together. You are still competent. You are still high functioning. Your team probably thinks you're fine. Your family probably just thinks you're a little disconnected. But inside, you're exhausted, irritable, disconnected, and wondering if you chose the wrong path. Code Blue coaching is not about quitting veterinary medicine. You've already invested $250,000 or more in your education, and there's also been time, energy, love, and compassion given to vet med too. This is about reclaiming yourself inside of vet med instead of giving up on it. Over 6 months, I partner with you and hold your hand as we identify patterns keeping you in survival mode. We rewire the perfectionism loop that constantly happens, rebuild your self-trust and your self-worth, create boundaries you can actually hold, and you have your accountability from yours truly. Don't forget, we also get a one-on-one personalized recovery protocol just for you that will help you for years beyond our coaching time together. So what you get is accountability, nervous system tools, and a true hand-holding pattern that will help you through with a white glove experience. And if you've been waiting for permission to choose yourself, now is the time. Make that extra moment to prioritize you so that way you can sustain your career in vet med. Now, if this calls to you or you're curious, go to evolvevets.com where you can learn more and book an alignment call with me so that way we can better discuss if this is the right next step for you. I hope to see you in there and that we can stop this code blue moment. Now, while you might see in human medicine a lot of shocking and those types of things, in animal medicine we rarely see. It does happen, it's just more rare that we see shockable rhythms on the EKG during a CPR. And so what happens in this moment, in working in an open concept ER, everything gets very quiet. We turn off the music, the nurses and team all come together. The doctor is coordinating and running the CPR code, and also instituting the conversation with the client. And as you do this, the silence falls, and the only thing you can hear is the machine running, and usually the customer crying. And in these moments, there are a few things that happen. The team is very focused, so we know exactly the steps that need to be done. We go into go mode, very focused on the pet and doing everything we can to save their life. And around us, there is a world where people that don't even know this owner are getting up and hugging the customer saying, these are the best in the world. These veterinarians are the best in the world. They're going to do everything they can to save your pet. And you see this combination of humanity and bringing people together that is so beautiful. And it is also very heartbreaking. You know, in those moments, there's been so many times I've done a code and I noticed myself starting to cry in the middle, like my eyes well up with tears in the middle of doing chest compressions. And I just look up and just tell myself, focus, Bethany, focus. And I can't feel, in order to do my job well, I can't feel what I'm feeling for that pet. And there are moments in that CPR where we go from doing the chest compressions and then I pop back over to the client and I say, okay, we've done 3 rounds of CPR. You know, the statistics are that we have much lower significant chance of being able to regain a heartbeat at this point. Would you like us to continue CPR? And the moment that they say stop CPR, we call time of death. And it is quiet. Usually at that point, there are other people in the room crying too, not just the customer of the pet that's passed, but clients along the sidelines who have watched the incredible work that our team did to try and save the life and the grief of the person in front of them who just lost their favorite pet. And those moments are so incredibly hard, and somebody has to be alive and capable and functional to do those jobs. And when we do get them back from CPR, which is statistically not common, but it does happen. And when we do have a patient return to ROSC, it is an incredible thing. But there's still a long journey for them to overcome any other disease processes so they can live a long, happy life after. And when you let the customer know Fluffy died, that's when there's this big giant wail that fills the silent room and everything stops moving. You take them and their pet into a private room where they can have space to be with one another. And you go back to pull off your gloves, wash your hands, take a deep breath, and get on to the next patient that's there in front of you. And that's the reality of most CPR codes and code blues in the emergency room at a vet hospital. And because there's no pause button, you just have to keep going. And when you finally get home at 3 a.m., you're wired and exhausted all at the same time. You lie in your bed, replaying everything, wondering if you could have done it differently, if you missed anything, and if they could have gotten there sooner. There's so many questions that roll through your head. And that is the job when a cardiopulmonary arrest happens in the emergency hospital. And most of you probably know what it feels like. You've lived through it as a veterinarian, whether it's in an emergency situation or a general practice situation, or maybe you actually are a end-of-life care veterinarian who travels around to people's homes to perform the humane euthanasia procedure. You're carrying something real, and it really does deserve to be acknowledged. I had someone on my comments this week saying I should only say things like help the pet pass instead of using the scientific term euthanasia. And I want to tell you a little story about why I use the exact words humane euthanasia during this procedure. When I was 2 years out of being an ER veterinarian, I used to say gentle words, more gentle and less direct words around this topic because it was a sensitive topic and I wanted to be an empathetic veterinarian. So I used to say, like, we will put him to sleep, or putting him to sleep will, stop his breathing and stop his heart. Until one day I had a customer ask, well, if he goes to sleep, when will he wake up? And in that exact moment, everything I learned about giving clear and kind feedback mattered. It mattered to be direct. And even though I was describing sedation and what happens when the euthanasia solution would be delivered and that it would stop the heart, they thought the drugs would wear off. And that is not the case when we perform humane euthanasia. That heart stops forever. And in situations like this, I began to slowly realize using the scientific term of euthanasia and death does not bring out a lack of compassion. It brings a layer of clarity. You never know what that person's understanding or exposure of that medical procedure is. It's a complicated topic. Different religions have different beliefs, and it's complicated. They're emotional. And some people's cultural backgrounds also don't know. My boyfriend is Brazilian, and when I told him the story, he actually said, I don't think I would have known what you meant culturally. It's just different when you say put to sleep. Like, he probably would have thought the same thing. So you never know someone else's understanding or exposure to this topic. It's a very complicated topic with many of emotions and layers. And the most kind thing you can do as a physician is use clarity and directness in these terms, and you can relay empathy in many other ways. So high level, now that we've talked about the CPR, I want to talk about actual humane euthanasia procedure and what I might give some tips or tricks that I've learned, usually from failing a few times, to my younger vets out there. So one tip that I've learned is using the term cremains instead of using the term ashes. Ashes, what I learned from crematory training, is something that you find in your fireplace, but cremains are handled in a different way. There is a different level of respect to the pet. And so using that term is just more sensitive and more kind and more respectful and honors the pet's life. And of course, we have the ways that we can remember your pet. So paw prints, hair locks, you can take parts to become jewelry. You can make unique urns, whatever it is to make the process special to that pet and that client. That deeply matters. In my hospital, I also had us sign a memory book. And what that looks like is they can essentially write down their favorite memory of their pet as a way of processing and just remembering their time about their pet. I commonly, when I go in the exam room or the comfort room, I usually ask what were your pet's favorite things to do and what were their favorite memories together when they got their baby. Just really, especially since I am in the emergency room and I don't know the pet's long-term lifestyle or how long they've been with their pet parent, it just helps me get to know them a little bit more and shows them that I do really care about their pet and their individual situation. Now, when it comes to the actual procedure, I do typically describe the process. I will tell them that I'm going to flush the catheter to make sure that it's patent with saline. And then I will tell them, like, hey, this white medication here will lead us into sedation. After this medication takes effect, we won't see, hear, or feel anything. We'll be completely asleep. And I would really recommend you talking and comforting your pet so that your voice is the last one they hear before they fall asleep. And then this pink medication that I give is going to be the one that actually stops the heart. Afterwards, I'll take my stethoscope and listen for a heartbeat. Once there is no longer a heartbeat, I'll let you know. After I do the procedure and I listen and I know that the pet has died, I will actually lean over to the pet parents and put my arms on them and say, Fluffy has earned their wings and she has passed away. And I want to give you, and I'm so sorry for your loss, I want to give you as much time together as you need. And then we have a doorbell system where they can ring a doorbell, which alerts my nursing team, hey, they're done and we should go, take care of them and help escort them out of the hospital, because usually at that time they're pretty emotional and they just want a little bit of peace and to be guided out safely. And then we take care of the pet from there. And if y'all have other tips and tricks on what works well in the event of the procedure itself, I tried to, in our hospitals, we make just safe, comfortable areas for people to rest. I know at-home euthanasia is a very beautiful thing. I have some colleagues that actually do that and really find it enjoyable and restful, being able to go into customer and client homes. So the pet's most comfortable, they're comfortable, and it provides like flexible hours. So, for some people this is their love language, is honoring pets in their final moments by being an end-of-life veterinarian. And it is a beautiful process. So if anybody who listens to my podcast does that and wants to be interviewed, please let me know, because I think that could be an interesting topic too. Now I'd love to talk data, because sometimes it helps us to know that this isn't just in our heads. It is actually something that is statistically proven. Now, moral distress is prominent in veterinary medicine. And there was a study led by Moses and colleagues that found out that 4 out of 5 veterinarians will experience an ethical conflict when it comes to how we proceed with a case. So I've experienced this before in my life, and I'm curious if you have experienced that too. When asked specifically about inappropriate euthanasia requests, 63% reported moderate to severe distress. Now, what does that actually mean? For me, the way that I experience this is when I'm giving a recommendation for a pet and the customer tells me, well, what would you do if it's your dog? That leads to severe stress, because when I'm a veterinarian, I can have my veterinary recommendations and my vet hat on. But when you ask me about my dog, it immediately pulls me into this emotional state, and in my eyes well with tears. And there's an immediate, please don't ask me what I would do for my dog. This is your dog and your situation, and everybody's situation is uniquely different. I can provide you my medical recommendations, but if it was my dog, I would be making this decision with my partner. And that answer might change depending on my financial situation at the time, where I would be living, how my dog's been doing at home, right? So my situation is always going to be very different from the situation that this customer is experiencing today with their pet. Many of my clients also find this to be challenging, where they struggle with this concept of what would I do if it was my dog? And how do I emotionally separate my personal pet from the work that I have to do at the job? One thing I personally do with euthanasia is let them know that it is an option. And let's say, for example, I have a lateral patient that comes in. I don't know why. I just know that it's in shock. It's going to need a full workup and pretty significant immediate intervention. I'll start the basics like oxygen therapy, IV catheter placement, bolus, PCV, total solids, the big 6, all of those things will get done. But then we reach a point where I go into discussion mode and I say, okay, we're going to have to do a full workup. And this is so severe, we might even need several days in the hospital. I would anticipate potentially several thousands of dollars to better understand what's going on and then stay in hospital, fix it. We're considered critical right now. Some customers after that spiel might say, well, he's 14, hasn't been getting around as much lately. He's been only eating every few days, and I've been worried about his quality of life. he's lived a good life with me and I might consider humane euthanasia at this time. Versus other customers might say, no, I need to run every test. I need to better understand what's going on with my dog. And I need to know if it's something that has a good prognosis to see if I can save him. And this is one of the stressors of euthanasia. There was a research study published in Frontiers Veterinary Science that found euthanasia is one of the most significant moral stressors that we have in our profession. This can contribute directly to emotional exhaustion, depersonalization, and compassion fatigue, which we know are all things that lead to burnout, like we've talked about in previous episodes. Veterinarians are part of the whole life cycle of a pet. You can start coming to your regular veterinarian for vaccines at a young age, and then at age 12, come to them for end-of-life care and humane euthanasia. And we are the ones who get to know them throughout their journey, their whole life, and we are the ones who perform that final procedure to give them peace in the end. And we know that perfectionism actually makes that worse. There was a 2015 study, which is a long time ago, but I found it to still be impactful, from the Australian Veterinary Journal, that found that veterinarians with high traits of perfectionism experienced more intense moral stress. Meaning, the harder you are on yourself, the more euthanasia-related distress that hit you. For me, this is interesting because we do have moral stress and we are hard on ourselves. We wonder if we did everything we could for the pet, if there was any other, discount we could have found or a thing we could have done to give them the best outcome possible. And that self-evaluation can sometimes make it even harder for us to do our job with a clean state of mind and eliminate struggles with burnout. So if you're someone that replays cases, questions your decisions, and holds yourself to quite impossible standards, you are not alone. We actually had a perfection episode a few episodes ago, so scroll back down and find it if that sounds like you, because we've deep dove this one before, and it will continue to be something we talk about here at the Evolve Vets. If you love this podcast, you find yourself nodding along, thinking, this is exactly how I feel at work, and sometimes even outside of work, then I want to invite you to something even bigger. Come with me to the Evolve Vets membership. It's my online home and community for women in veterinary medicine who are done surviving and ready to start evolving. Inside the membership, you're going to find race-approved masterclasses, vet reset meditations, live monthly coaching with yours truly, and a community of women who actually get it. It's not toxic positivity. It's not just another membership you sign up for. It's learning how to manage your energy, protect your boundaries, and build a sustainable career in veterinary medicine. It's your choice to move from self-abandonment to self-devotion. And the truth is, you don't have to do it alone, my friend. Come evolve with us. Emergency vets carry a heavy load, and research comparing general practitioners to ER practitioners found that ER vets were specifically more exposed to patient death, euthanasias, and CPRs, and they were more emotionally distressed from euthanasia, including financial euthanasias, because the ER does have higher costs associated with our services, emotionally distressed clients, and delivery of bad news, right? If things are coming to the emergency room, it's usually pretty bad to get a client off the couch and into the ER. Not all euthanasias are the same. And I think it's okay if we go in a little bit deeper on the different types of euthanasia. There's the behavioral euthanasia. Maybe it's a healthy pet or one with a treatable condition, but maybe they get brought back to the shelter because they couldn't get along with other pets or family members in the house. This one is something that our shelter veterinarians are highly exposed to, especially if they work in a shelter that's a kill shelter, meaning they perform euthanasias on cases that are not adopted out or have behavioral issues such as biting other pets, other people, and they're really complicated and really hard. I remember for me in my 4th year rotation, shelter medicine was one of the hardest rotations for me. I cried every day because we had an amazing partnership, but many of these euthanasias were either behavioral euthanasias or euthanasias for just shelters being overly full. And I cried so much those days, those weeks that we were at that shelter, because it is so deeply affected of the volume that you deal with on that setting. So shout out to all the shelter vets out there who have incredible hearts and do a job that I am not capable of doing. This type of euthanasia creates moral stress and moral injury because you're asked to do something that violates your personal values. It's something that you don't necessarily, and this was why this one was so hard for me. It didn't personally align with my values, and that type of medicine is incredibly heartbreaking. And it costs something to be in that scenario for me. And behavioral euthanasias are hard for that same reason. We do see some of those in the emergency room. I'm sure general practice veterinarians see them more, but it does add up. The cost adds up because it conflicts with who we are and what we believe in at times. There's the euthanasia that feels a little too late. So the pet who maybe has been holding on a little bit longer because their owner wants to hold on for one more treatment, or, they want more time with their pet. And that's a completely normal and valid feeling. And at the same time, is that the right thing for the pet? I remember, oh man, this case was so tough for my team. When I was a medical director, we had a case that was in our hospital and the client wanted to keep doing treatments. The veterinarians recommended euthanasia, and that just wasn't something they believed in. And instead of being sad and down about it, we tried to reframe that concept and say, okay, well, my grandpa was on hospice at one time. We can provide hospice-like care to this pet and make sure that they are comfortable until they pass naturally. And that is an okay form of how we can process through this. So sometimes people wait a little bit too long, and then we hear their stories about how they regretted waiting too long. And then sometimes we have the opportunity to reframe our recommendation from euthanasia to can we provide hospice for this pet here? And sometimes what I found for me and my team, that reframe really helps us show up better for the customer and their beliefs and what they're going through, and provide just a place that they can come back to in the moments of those challenges. I also see the pet is suffering euthanasias, which is incredibly hard for me. This category is emotional. In one scenario, I probably was 4 years out of school seeing an emergency case. It was an oxygen-dependent 14-year-old Yorkie who had CHF, and its lungs were filling with fluid. We were doing full diuretic oxygen therapy, trying to help provide relief to this pet so we can get them off of oxygen and back to living their normal life. Unfortunately, this pet was not responding to treatment. And we ultimately got to the point where I was recommending euthanasia. And that was not something that the customer wanted to proceed with. And so I strengthened my language a little bit around what it would feel like for the pet. For me personally, as a veterinarian, I took an oath to advocate for the pet no matter what. Even if it disagrees with what the customer wants, I want to always advocate for what the pet might be feeling or what they might be understanding in that moment. And so I started using words like the pet is struggling to breathe, and it can feel like they're gasping for air. And they wanted to take this pet home anyway. And we removed this adorable Yorkie from the oxygen tank, and we were attempting to remove a catheter so they could go home. And within less than 3 seconds out of oxygen, her tongue went blue, her entire gums went cyanotic, and she was just gasping. And I will never forget the sound. It's this like struggling to breathe. And I just broke down crying in the middle of the treatment floor. I didn't know how to relay the fact that I took an oath to defend and advocate for that pet. And ultimately, I'm not the decision maker. I can't make the decision to choose euthanasia for this pet who's struggling to breathe and feels like they're drowning. I can't make that decision for that customer. And that is a very helpless feeling. And luckily, one of my nurses took over, and the client asked why I was having such a response to this. And she reiterated that this is a really big struggle for us to see pets that can't breathe. And luckily he chose to euthanize and not take the pet home. But sometimes it's tough for us to even be in that pivotal point where we have to get to the point of breaking down in front of someone to hear what the pet needs. So those where the pet is suffering, I feel brings a certain layer of discomfort for us as veterinarians who've set out to save these pets. And then even harder ones, right? We have the financial euthanasias, the pets we could have saved if the owner had, more money, or they had the money to treat this. And, in those moments where we're working through the estimate, we're trying to find things that we can waive or discount, or small things we can do to buy the pet time. This creates guilt and rage, and it's a systemic grief that's hard to name, but it's complicated because it's not our fault, and yet it feels so heavy and complicated in those moments. And then, of course, there's like the beautiful euthanasia where everything's going right and the whole family comes and everyone's present and you feel like you gave them all a gift. And that one is emotional in a completely different way. It's emotional in the peace and in the beauty and understanding how much that pet was loved while they were here with us on this beautiful earth. And all of them hurt and have joy and peace in different ways. Like for the pet that was struggling to breathe, like even though it was painful to watch, like the right thing happened and that pet was euthanized that day. And same with the beautiful euthanasias. Like there's something special and painful, but like peaceful about everyone being there and being a part of that pet's passing and journey. And over time, we can develop emotional detachment as a survival mechanism. When we're in the euthanasia, do we let ourselves feel? Do we let ourselves cry? And even if you don't cry real time in the moment, do you give yourself space 10 minutes on the way home to just be silent? Like, don't distract your brain with another podcast or another music or song to listen to, but do you just allow yourself to sit with the grief that can come up sometimes? And we can distract ourselves. We can pretend that we're fine, and that can probably work for a while. You can get through your shifts. You can do good medicine. You can seem fine, but eventually you can build up this wall that blocks off all this hard stuff. But it doesn't just block the things that are complicated. It starts to block everything. You feel numb from not only the difficult euthanasias, but from the joy, from the connection, from the intimacy, from the interdependence with others. And it can even like leak into family life. I've had clients that have told me stories about like, I think it's all adding up and I can't even be excited at my kid's soccer game. Or when your partner says that they love you and you hear it, but you can't feel it. And those layers of building a shield around yourself, it can come from these moments where we feel like we need to be strong and we don't process these feelings when they come to life. It's called depersonalization, and it makes you wonder like, oh, I should be happy, so why am I not happy? And it's one of the 3 core components of burnout, which we've talked about in the past around our energy management podcast. So feel free to go back a few months to find that one. It's a really good episode. It's incredibly common in our profession, and you're just a human who's absorbing grief and needing a way to process it and know where to put it. All right, I want to give you some evidence-based tools on ways that we can shift from blocking things off, numbing out, into a place of just really processing and understanding something to do with the pain that we experience. Because we can't just ignore it and put it off, and we can't just keep going on to the next room. We need to prioritize ourselves and better understand the component of self-care so we can have the best life possible. So here are a few interventions that you can try that have been studied for veterinary populations with or other high stress healthcare type settings. The first one I'd love to recommend is going to be the membership that we have. We actually have a shift shedding meditation that's online for free. You can go to evolvevets.com and listen to this meditation around how to actually shed your shift, and made here at the Evolve Vets, just unique for you, free resource, sign up. And then if you join the Evolve Vets membership, we also have a entire recording around euthanasia specifically, which it actually talks you through, hey, could you just take 5 minutes right now, walk outside, go to the bathroom, cry it out, maybe just represent that pet and honor that pet that you just euthanized real time. So that way it doesn't build up and you can have that emotional release while you're still in the hospital and give yourself that self-love and self-care that you need. So that's number 1. Number 2 is acceptance and commitment therapy. So there was a 2022 randomized trial in JAVMA that tested the ACT-based program for veterinary teams. And the results showed a reduction in burden for stress and burnout. A is for accept that difficult emotions are part of the work. We want to diffuse from any unhelpful thoughts. Notice them, but don't be controlled by them. The C is for connect to your values. Why are you doing this work? This is everything that we talk about at Evolve Vets. Everything is values aligned and values focused. So do things that are aligned with your values and set boundaries around the things that are not aligned with your values. And then, of course, the T is take committed action. So how can you commit to action associated with the values that you do have, even when it's hard? One simple act tool is when you notice a painful thought like, I should have done more. And instead, try saying to yourself, I'm having the thought that I should have done more. But that's just a thought. It separates who you are from a thought that you're having. Just like Dr. Joe Dispenza says, you can't believe every stupid thing your brain thinks. So let's separate those thoughts from who we are as a person. Even this tiny shift creates distance, and it reminds you that you're not just your thoughts, you're just observing them. Tip 3 is going to be a self-compassion practice. Now, research shows that self-compassion is protective against burnout, especially in populations like ours that have perfectionistic challenges. Thanks, Vet Med. Self-compassion has 3 components. Self-kindness is one, so treating yourself with the same care you would offer to a friend. Common humanity is another. Remembering you're not alone. Other vets are going through what you're going through. They're feeling similar ways, and you are not by yourself on this journey. And the third one is going to be mindfulness, acknowledging your pain, experience it, without over-identifying with it. So you can feel it and it can be something you process through, but it's not the only thing that you are. A 2024 study found that veterinarians with higher self-compassion had lower stress, anxiety, and burnout. Self-criticism, on the other hand, was one of the strongest predictors of psychological distress in the workplace. So when your inner voice says you're too sensitive, you should be over it by now, why are you crying in this euthanasia, other people handle this better than you do, that voice isn't helping you. So try this instead. Place your hand over your heart, take a deep breath, and say, this is hard. Other people feel this too. And I'm allowed to be gentle with myself right now and understand that this is a part of the human experience. Things are going to be really good some days and really bad some days. And I'm just in a season of challenge and a moment of feeling sad or a moment of feeling angry, and that is normal. It sounds so simple, but research shows it actually shifts your nervous system from threat mode to safety mode. 3 is having a structured debrief after a difficult case. So this is one of the reasons that our euthanasias accumulate, and we don't really take time to process it. We just grab the next chart, move to the next room, see the next triage. Whatever your environment is, we don't take the time to process. And so your brain can't really move on either. It stores the experience as unfinished, and your subconscious will keep looping and sending you signals to process it, finish that emotion. Maybe you'll even have intrusive thoughts or dreams or emotional numbness around the situation, trying to get you to complete the loop. Once you complete the loop, it settles and you can move forward. But until you take that structured debriefing process, the loop is really hard to close without it. You're compartmentalizing or pushing it down, usually for it to bubble up later. So after that hard case or euthanasia, take the 5 minutes to name what happened factually. Name what you felt emotionally, name what you did well for self-acknowledgement, and name what you'd want support with in the future. This can be done alone, maybe journaling, meditation, as we do at the Evolve Vets, maybe with a trusted colleague or a therapist or coach. Many of our members do all of the above. And the key step is don't skip it. It's so important. 5 is going to be have a ritual or closure around a tough euthanasia. Many cultures have rituals around death. Funerals, wakes, candles, prayers, and veterinarians don't usually have something like that. Create your own small ritual that can help your nervous system register that something significant just happened and that it's okay to let it go. I do a simple practice with a candle each week where every time I light a candle in my house when I'm working from home or catching up on emails, that I just take a few moments to think about all the pets I euthanized that week. Every time I light the candle, I'm sending them love and hope and just peace with wherever they're at. And maybe you keep a small notebook where you write the pet's name or something you want to remember about them. Maybe taking 3 deep breaths before walking through the front door and say, okay, this is my work self to my home self. And I'm going to leave all the pets that I helped pass today outside. It's not magic, right? But it is something meaningful that is showing your brain and your body that it's time to move forward and that what you did was hard. It acknowledges the fact that there's grief and sadness and that there were a lot of components that you were meant to manage all in the same day. And of course, the last tip is going to be know when to get professional support. If you're having intrusive thoughts that won't stop, maybe you're having nightmares, flashbacks, emotional numbness that just doesn't go away, difficulty functioning, and maybe at work or even at home, like just difficulty showing up in your day-to-day tasks, thoughts of self-harm or suicide. These are all reasons that you would want to find a therapist, seek professional help for any of these challenges or symptoms that you might be seeing. And if you do need to reach out to a mental health professional, there's no shame in that, right? Everybody carries a lot in veterinary medicine. You deserve support and longevity in your career. There's also the Not One More Vet crisis line that's available to you if needed for immediate support. There's the National Suicide and Crisis Lifeline if you're feeling any of those feelings and you need additional help. Highly recommend reaching out to them if you're struggling. They're there and they're free. Here's the reminder. You chose veterinary medicine because you care. You walked into vet school with the purpose and of healing animals, and your heart was full. And your heart has been asked to hold so much. The pet parents are deeply affected by you being there with them, and they appreciate you being there with them. I've seen so many comments over the last week that highlight this exact purpose, and you make a huge difference in their pets passing. So thank you to each of you who give so much in these moments of challenge and grief for our pet clients and pet owners and to the pets themselves. Every euthanasia is a life. It's a relationship and it's a goodbye all in one setting. And what you do, the work you do is meaningful. And you are the one who continues to show up again and again. The weight you carry from this procedure is real. The grief is real. The exhaustion that comes after is real. It's a duty that we have to take care of the pets. And honestly, they're people too. So you are whole, you are tender, you are compassionate, you're kind, and I and so many owners and so many pets all across the world are grateful for the work that you do with humane euthanasia. Please take care of yourself. Try out some of these tips and tricks. Let me know which ones work best for you, and let me know other tips and tricks for people to have a better goodbye with their pet. I feel like I'm constantly learning how to make my euthanasias better, how to make my CPR codes better, how to make my language just as kind and direct so they land the point while also being an advocate for the pet on the other side. On that note, thank you for being here and listening to our chat about euthanasia. It means a lot to me that y'all are here and listening. And together we'll stop revolving and start evolving. Thank you so much for being here, and we'll see you next time. Bye. Thank you so much for listening to the Evolve Vets podcast. It truly means the world to me. If this episode supported you or sparked something new in you, please go to evolvevets.com to become a member or join our coaching program and truly continue this work beyond the podcast. Let's evolve together.